Dr. Anjali. Meibomian gland dysfunction and dry eye disease in mucous membrane pemphigoid.
Hello, good morning all. I shall be discussing the case series data of objective evaluation of Meibomian gland dysfunction and dry eye disease in mucous membrane pemphigoid patients, which I did during my post-graduation in PGMR Chandigarh. So as we know, mucous membrane pemphigoid is an immune-mediated systemic disease which affects females more commonly than males. It usually presents in 6 to 7 decades of life and affects the mucosal surface of the body like eyes, nose, mouth, upper respiratory, anogenital and gastrointestinal tract. It results in formation of subepithelial blisters which rupture and heal by fibrosis. So ocular MMP manifests as a chronic progressive cicatrizing conjunctivitis which has a risk of vision loss if left untreated, and it is quite common in MMP patients. Up to 80% of the MMP patients show ocular involvement. It ranges from dry eye disease to corneal ulceration, vascularization, keratinization of the ocular surface to symblepharon and ankyloblepharon. So the objective of our study was to evaluate the dry eye status in these patients and to find out if there are any early changes in the meibomian glands on meibography. So ours was an observational cross-sectional study done for 15 months in which we divided the patients into 3 groups. First group included patients with obvious ocular complaints which were being treated in the Department of Ophthalmology, and the second group had systemic mucous membrane pemphigoid without any frank ocular complaints. They were being treated in the Department of Dermatology, and group 3 had control patients which were age matched for both the groups. So all those patients which gave consent were known cases of MMP, aged more than 12 years, and were under treatment and had quiescence for at least 3 months were included. And all those which had Foster stage 4, previous eyelid surgery, contact lens use, radiotherapy, or history of use of isotretinoin, anti-androgens, hormonal therapies, oral contraceptive pills, and those which were pregnant and lactating were excluded. So slit lamp biomicroscopy was done for all the patients to evaluate the lid margin, meibomian gland orifice and the ocular surface, followed by ocular surface disease index scoring to evaluate the dry eye related complaints in these patients, and a dry eye workup which included tear film breakup time, ocular surface staining, Schirmer test, and we calculated lid margin abnormality score and a Meibo score for all the patients. Meibo score tells about the expressibility and about the quality of meibum expressed both. And meibography was performed, and this is the representative image of the meibography image that we get after the LipiView. And we used images software to calculate the area, total lid area, and the B image shows the area of meibomian gland loss. To calculate the dropout area, we divided the area of loss with the total lid area multiplied by 100, and we graded as grade 1, 2 and 3. 1 included those having meibomian gland loss less than 1/3 of the total lid area, grade 2 had 1/3 to 2/3, and grade 3 had loss more than 2/3 of the total lid area. So all the variables were described at mean and standard deviation, and ANOVA was performed to examine the significant difference between the 3 groups. Pearson correlation test was used to measure the strength and direction of the relation between the dry eye parameters. A total of 123 eyes were enrolled, and 5 eyes in the ocular MMP group were excluded because they had stage 4 disease. As we can see, the OSDI scores in ocular MMP group were significantly higher, which was confirmed on ANOVA test and the post hoc analysis, which suggests a higher dry eye related complaints in these patients. Also, the Schirmer scores in both ocular and non-ocular MMP patients were lower. That showed significant dry eye disease in MMP patients as compared to the control. Also, both the non-ocular and ocular MMP patients had lower T-BERT values, suggesting a evaporative dry eye disease in these patients. and a significantly higher lid margin abnormality score in ocular MMP patient as compared to the age-matched control, which is further compounding the tear film instability and dry eye-related complaints in these patients. Meibomian scores again were higher in the ocular MMP group as compared to both the groups, and Meibomian gland dropout area were significantly higher in both ocular and non-ocular MMP patients as compared to the control group. The severity of MGDA loss was also higher, 64% in
Time is over.
so 64% of the patients in ocular MMP group had moderately severe MGDA loss, and 43% had in the non-ocular MMP group. So the importance of our study was, it was the first study to demonstrate the MG dropout area in MMP patients, and it outlines the potential damage to Meibomian glands in these patients, and need to early diagnosis and appropriate disease management of these patients. Thank you.